few years ago, I had the opportunity to take care of a older person, but young on today's standards. She was in her 70s. And she had been out dancing in perfectly good health with her husband at a Neil Diamond impersonator concert. And in the middle of dancing on the floor, she dropped. She fell to the floor, and she was immediately unresponsive, was brought to the hospital, and was sadly determined to have had a very large head bleed. And I took care of her in the ICU for a day. She was on life support. Once it was determined through various testing and expert opinion that she had no chance of survival, we took her off life support. Well, she's younger, so she had a very good heart, and she lingered for the better part of a day. And the family was in and out, and I encouraged them to come and go, that the patient will go when she's ready, whether they're there or not. And at one point, finally, in exhaustion, they did leave. And I can tell when a patient is ready to die when their heart rate starts to drop. So this patient's heart rate had been fine, and then all of a sudden, I knew she was dying from her heart rate. So I took one of my other colleagues, one of the other nurses with me, and we went in there because I was not going to let her die alone. And we each sat on each side of the bed and took her hand, and because she had been at a Neil Diamond concert, we started singing Sweet Caroline to her as she passed away. And I still get emotional about it. So she passed away with us singing to her. And it's just one of the moments that really stands out in my career.